So just a little bit from me around the kind of genesis of the Wigan deal. Can we have a quick show of hands who's heard of it? Okay, great. Maybe around a third of people have and 2/3 haven't. If you are interested in finding out more about it, based on what I've said today, then the King's Fund did a really great evaluation of the deal. It's called Lessons Learned from the Wigan Deal. I'm sure it can be shared with you all, but I think it's probably the most accurate description of what we did and how we did it and how we involved all of our staff across the different organisations, all the public servants working in Wigan together, and how we involve citizens and community organisations. So it was a complete paradigm shift, and that's paradigm is a kind of complete shift and an overhaul. This is not a project. That's the first message I wanted to say. This is not just another project that you add on to a list of projects. It's a complete overturning of the way you think and the way that public servants have been trained to think over the last 40 years around assessing people and referring them to different bits of the system in a very fractured way. That's really what we used to do and what some places very, a lot of the time do. So a little bit about what we did in Wigan. We started it back in 2011. It was before my time, actually, so people say it's me that created it. It's not me. It was very much an iterative process. We started off with some work with a woman called Hilary Cottam. I don't know if you've come across Hilary, but she would be a great speaker if you wanted to invite her to one of these events. She's fantastic. She's a social entrepreneur. She wrote a fantastic book called Radical Help. And if you want to know the kind of business case for doing this, read her book, Radical Help. And it really sets out the case for doing this. And what she says, and I totally agree with her, is public services are broken currently. So that's your starting point. Public services are completely broken in the way that they are organised at the moment. What was set up back in the 1940s as a kind of top-down, benevolent 1940s factory model of we give everyone the same in the Beveridge report according to their need is completely not moved with modern times. And Beveridge said at the time that he'd forgotten all about care. He'd forgotten about social care and he forgot about care because in those days women did care for free. And you might argue that's what they do these days as well. Not all women, but not only just women, but it does tend to be women who work in very low paid jobs. So care was never really a part of the creation of the welfare state. And that's what she tries to correct in Radical Help. She did some work with us with 25 families whose children were on the edge of care. This will be familiar to people like Paul in the room, who's got this background very strongly. And what we found, Gladys as well, what we found was that of the 25 families that we worked with, we were spending between $250,000 and $500,000 per year per family across all the different agencies working with them to support them. And at the end of the year, they were either in the same position or usually a worse position. So despite the efforts of how we'd tried to work together to support them, we'd spent 80% of our time on assessing them and referring them to different bits of the system, rather than actually building a relationship with them and helping them. So this work, coupled with the fact we had to save almost 200 million, we were number 3 on the list of most cut councils, according to the Institute of Fiscal Studies. We had to make a huge amount of savings very quickly. We also did some work with older people, with Nesta, on a Creative Councils project, where we found very much the same. We were spending a huge amount of resource on assessment and referral, and very little on building a relationship with people, and very little on community solutions. So we thought institutional solutions were the best for people, rather than trying to build and invest in that social infrastructure to keep people out of care, to keep people out of hospital, and to keep people fit and well and socially connected in their own homes and in their own communities. So those 3 things, having no money, the work we did with Nesta and the work we did with Hilary, led us to the creation of a deal. So it was, and it didn't happen overnight. It took a while to embed it. I would say it took 3 years to actually start to feel it was making a difference. So don't see this as being a short-term, quick fix project. It will take you at least 3 years to do it. The first thing we did was a huge bit around values with our workforce. So previously we'd just done training, which was very much around the technical aspects of the job. We'd never really done something together as a system across the NHS, primary care, acute, social care, housing, police, criminal justice. We'd never done anything like that together. So we started to do something called created this thing called the Be Wigan experience, which was all about the values that we hold dear. And we used an ethnographer, so we employed a freelance anthropologist to come and work with us to really try to retrain people's brains. I know it sounds crazy, but to stop this tick box culture that very often in public services we have, and to get people to really learn how to listen and walk in people's shoes. So it's called Dr. Robin Farrow. He's London-based anthropologist, ethnographer, he's excellent. But not only did we use him to design this Be Wigan experience, we got him to work intensively with all of the public servants working in Wigan and to do a half-day immersive session with them on deep listening. And we would get staff in from different bits of the sector to talk about the difference it made to their jobs. So whether it was a police officer, housing officer, midwife, a doctor, they would talk about how the ethnography had changed the way they approached their jobs. We did manage to make the savings, so we worked on trying to close down the things that didn't work. So, for example, in adult social care, we had 25 day centres where we would pick people up in a minibus, take them there, sit them with people they didn't know, probably didn't like, and just sit them there all day. That package of care was around £4,000 to £5,000 a week. So instead of that, we started to ask people, what does a good day look like for you? What do you really enjoy doing? And how can we invest in making your days like that? So whether it's doing physical activity programs with people who share the same interests. So in Wigan, it's a big rugby town. We did something for people suffering with dementia called Rugby Memories, which was getting the players to come in and talk about their experiences, get the people with or without dementia, actually. It wasn't a stigmatised service, to bring in their old programmes and to really engage with each other and talk about things that they enjoyed, which was rugby, not a day centre environment, really expensive municipal solution. So we did make the savings. We invested 15 million in the community and voluntary sector over a 5-year period. We froze council tax for 8 years. That was our part of the deal, that we said we would freeze council tax and we will pass the savings on to citizens. So £500 per family in a Band D property. That was the saving of freezing council tax. That's the difference it actually made. But in return for the deal, we want people to look out for the neighbours, to be part of the community, to tell us when we get it wrong. So there's this thing around humility as one of the core kind of values in the way that we work with citizens. So the whole idea of a community paradigm, going back to the kind of original question, is we've had the state paradigm for many years. We've had it since the creation of the welfare state in the 1940s. It was of its time. We've had the market paradigm, which was in the 80s when I did lots of outsourcing. I'm sure Gladys and Paul and others have been involved in that. Outsourcing was the best thing since sliced bread. You know, let's privatise everything. In Blackburn with Darwin, where I worked with Gladys, we did this huge capita private outsourcing thing, and it was seen as being super efficient and amazing. That's what everyone should aspire to. It didn't work, basically. You know, the marketisation paradigm, you know, it just doesn't work. It's not effective. And we outsourced too many things and they were done very badly. And it didn't really save us any money. It actually cost us money at the end of the contract period. So now we move on from the state paradigm, the market paradigm, to a community paradigm, something which is around communities and looking at the assets that we have in a place. And they are the communities. They are the local citizens who live in that place. So 4 years ago at New Local, we created this thing called the community paradigm, and it's evolved over time. Huge amount of interest in this different way of working with citizens, investing in citizen-based solutions, transferring power to citizens, transferring community assets to citizens. We transferred swimming pools, libraries, open spaces, and not in a kind of big society way where we didn't pay people for things that public servants used to get paid for. Not that at all. People would be paid a decent wage to do it. But we would see that the benefits of asset transfer were huge, absolutely huge. So this isn't just a project. That's just to sum up, because I know that we'll be moving on shortly. But it isn't a project. If you want to do it, don't do it in a half-hearted way. You've got to do it full on. You've got to get your strategic finance people involved, your strategic organisational development people across the system, not just in one organisation. You've got to engage differently with the community and voluntary sector and not have this parent-child relationship with them, which very often develops in places. I chair a hospital, and it's amazing. We overspent last year by 30 million, and the NHS just gave it us back at the end of the year. If a community and voluntary sector organisation overspends by 30,000, all hell lets loose. You know, it's a completely different way of treating people. So you've got to treat people with respect and trust them to do the right thing with resources that you give them, because they will do the right thing. We funded 500 amazing new projects through this thing called the Community Investment Fund. And in the end, we managed to add an extra 7 years of healthy life expectancy in the most deprived wards in Wigan at the end of the 10 years. And it's still going on now. My background's policy and strategy. I've written hundreds of the blasted things. Gladys can tell you some of the ones I've done that haven't worked. This is the only one that's worked, because it doesn't describe an aspiration and a set of actions, which most strategies do. It describes a relationship. We're changing a relationship with citizens. It's a partnership. We're going to stop doing things to you. We're going to work with you, and you've got a part to play in it as well. So I remember the King's Fund said at the time they released the report that the NHS needs this at a national level. It needs a different relationship with patients and with citizens. So I hope that's okay. And I've not gone on too long, Christine, but that was just a bit of an overview.